Well, South Africa has made history rolling out a promising new oral medicine to fight tuberculosis. It replaces an injectable drug which had toxic side effects, such as including kidney failure and hearing loss. South Africa is the first country in the world to take this bold step aimed at scaling up access to an effective new drug. Well, joining us now is the Director, MDR-TB at the National Department of Health, Dr. Norbert Njeka. Good morning to you, Doctor. Thank you very much for joining us here on Afro Worldview. If you could just talk us through, this moment when it comes to, the South African medical fraternity, how big is this moment for us? And also talk us through, the benefits of this new drug that will be used orally instead of being injected.
Yeah, thank you. Good morning to you and good morning to the listeners and the viewers. This announcement is a big one because in a long time we've been treating our MDR-TB patients with an injectable which has caused their hearing loss in some instances. And now we are moving to an injection-free regimen for most of our patients, which is very good. It improves the modality of administration of treatment, but also we get improvement in terms of number of patients that are cured.
With regards to the rolling out of this drug and with regards to accessibility, will there be any issues there, or are we expecting a smooth process?
We do expect the process to run smooth. From the 1st of July, our biggest sites will start with the regimen. And then on the 18th of July, on the birthday of Madiba, we will announce our plans in terms of expansion to cover the rest of the country within the next 3 to 6 months.
Doctor, if you could just describe to us the process of creating this new drug and the steps involved in that and how we had gotten to this point.
The discussion with the then Medicine Control Council started in 2011 because it was a new medicine. You can't just use any product in South Africa. You need permission from MCC. Now we call it South African Health Product Regulatory Authority. So we granted permission in December 2012, and we started a small study in March 2013 till 2015. We enrolled 200 patients, and we saw very, very good results. 3 out of 4 were cured, and less than 20% died. We found it to be very good because prior to that, 1 out of 4 will be cured, and 1 out of 2 will die. So it was really an improvement, and then we started to give to more patients. To date, we got 15,000 patients in the country have received, which is 2/3 of the rest in the whole world globally. And now we see even better results. We continue to see the trends that we saw in that small cohort of 200 patients, even when we give to thousands of patients. That's why we're saying that we should be every one of our MDR-TB and XDR-TB so that we can enhance their chance to be cured, but more importantly, decreasing mortality 3-fold.
Doctor, just lastly, with regards to the old injectable drug, will that now be discontinued completely? What is the plan of action there? As you have mentioned, it is quite toxic and has very negative side effects.
Yes, the injectable has a lot of side effects, but it does not harm everybody. So individuals who have already started and are about to finish the regimen with the injectable who do not have any problem should be allowed to finish. But should they experience a problem before they finish their last days of injectables, they should be switched. But that's really the first point. Those people who are already in it will be allowed to finish. And then new initiations, whoever starts treatment from 1st of July will start with an injection-free regimen. But then you might, this bedaquiline and all medicine we give to TB patients are antibiotics. With antibiotic, by chance, you find a few people who are going to be resistant to it, or people who are allergic to it, or people who can't tolerate it. So that small group of people who may not tolerate or are allergic to bedaquiline are the ones that will receive the injectable. It's going to be a very, very small number. I don't think it will make even 5% of total number.
All right, Doctor, thank you very much for providing us with this information and providing clarity on this new drug. That was the Director, MDR TB at the National Department of Health, Dr. Norbert Njeka, talking to us about this new and very promising oral medicine to fight tuberculosis. It replaces an injectable drug which had toxic side effects such as kidney failure and hearing loss. And South Africa is the first country in the world to take this bold step aimed at scaling up access to this new and effective drug.